You have a patient who is complaining of 10 kgs of weight loss over last 6 months, which was unintentional. The patient is a female patient of 25 years of age. She did not have any significant past medical history, but one of her relatives were diagnosed as cancer, but she does not know what type of cancer it was. The physical examination revealed nothing significant except from the lean and thin body structure due to weight loss. So at first introduce yourself, tell your name and your designation, check patient's identity and tell her the reason for today's meeting. Ask her if she wants someone else to be present in this meeting today. You can ask about patient's expectation from this meeting. Then you can start taking history. At first, ask about her chief complaint, which was weight loss. So the questions can be, when did you notice you are losing weight for the first time? She would say 6 months ago. Then ask her how many kgs, was it intentional or not? Ask her questions about her diet. Is it normal or is she eating less nowadays? You can ask about her appetite and some common GI symptoms that are related to weight loss. These are symptoms of malabsorption. So ask her, do you feel bloating? What about your bowel motion? Is it normal? Are you noticing any loose motion lately? Do you feel any pain in your tummy? Do you feel any acid brush or burning sensation or pain in your chest before or after eating? These are some of the general questions related to weight loss. Then you can go for asking about some specific questions that would be according to your list of differentials. Ideally, you should have formulated differentials of weight loss in a young lady before entering the examination room. Some of the differential diagnoses can be GI related problems like inflammatory bowel disease, malignancy, diabetes mellitus, hyperthyroidism, Addison's disease, inflammatory conditions, chronic infections like tuberculosis, and it can also be psychiatric. Anorexia nervosa can also be related to drug abuse. So you need to ask a few questions per differential diagnosis to exclude them. So for inflammatory bowel disease, ask about diarrhea. Please skip the questions that you have already asked, because no questions should be repeated in a station 2 scenario. However, if patient complains of diarrhea, then quantify the amount, frequency. Is it blood mixed? Have you noticed any mucus? Diarrhea for how many days? Is it always diarrhea, or have you also noticed constipation? Have you noticed any mouth ulcers, any pain in your tummy, or have you noticed any ulcer or skin rashes or abnormality around your private parts? Then ask some important questions about malignancy, including hematological malignancy. This can be, did you notice any bleeding through any of your body orifices like your mouth, your bowel passage or waterwork passage? And then also ask about any night sweats. Did you notice any fever, any chills? Weakness and lethargy are also common features of malignancy, so ask about these features. Did you notice any lumps and bumps in any parts of your body? After excluding malignancy, you should proceed to exclude diabetes. So ask her about her waterwork frequency, color, amount, because polyuria is a feature of diabetes. Ask about polydipsia. Do you feel thirsty always? Ask about nocturia, frequency of urination, recent urinary tract infection, etc. If she is diabetic, then ask about anti-diabetic medications or insulin she is taking and about her diabetes control status. Then to exclude hyperthyroidism, Ask her about any eye symptoms like eye pain, any problems with eye movement, excessive dryness of the eyes, heat intolerance, any shaking of body to exclude tremor, any excessive sweating and racing and pacing of heart to exclude atrial fibrillation or ventricular tachycardia commonly seen in hyperthyroidism. Then to exclude Addison's disease, ask her about dizziness and abnormal pigmentation over her skin. Certain inflammatory or rheumatic conditions can be also associated with weight loss, so ask her about joint pain, rash, hair loss, etc. To exclude chronic infections like tuberculosis, ask about travel history, any infectious contacts, any blood mixed sputum, fever, night sweats, etc. To exclude psychiatric symptoms, ask about patient's mood. Do you think that your mood is low nowadays, or is it elevated or normal? Then take complete medication history. Do you take any regular medications, any over-the-counter medication, any herbal medication? Do you have any medication allergy? Ask her about alcoholism and smoking history. Then take permission to ask about some private questions. Ask her about pill pregnancy and period. If the patient is female, always ask 3 P's: pill, pregnancy and period. Also take her permission to ask about her sexual relationship. Is she sexually active? Does she have a partner? And then ask her about drug abuse. Have you taken any illicit drug ever? Take complete family history, because many of the diseases causing weight loss are familial. Her past medical history, past hospitalization, past surgical history are also important. Always take some social history. What are you doing for living? Are these symptoms affecting your occupational life? Ask about her living conditions, financial condition, and family members. Offer social, familial, or financial support if needed. Then ask about patient's concerns and address all the concerns accordingly. And finally, summarize the findings appropriately. Let's consider patient has given you a history of type 1 diabetes mellitus, which was supported by her family history and recent urinary tract infection. So in this case, you can tell her that from this history, I think you may have diabetes mellitus type 1. It is a condition in which our body fails to produce insulin. One of the main function of the insulin to help glucose enter the cells, and these glucose are the foods for cell. So your cells are not getting enough glucose or food due to lack of insulin. That's why you are losing weight. Fortunately, we do have treatment for this condition, but before that we need to your complete physical examination and send some investigations like blood tests for you. And then I would also refer you to our endocrinologist or hormone doctor, and then he would provide you treatment for diabetes control. You would also need help from other specialties as well, like our dietitians and our podiatrist. If the diagnosis of diabetes mellitus type 1 is confirmed, then it is likely that you would need to take lifelong insulin therapy. Finally, check patient's understanding and summarize everything from today's meeting. Then say thank you and conclude the discussion with the patient and face the examiners. The examiners may ask you about the diabetes diagnosis criteria. For type 1 diabetes, someone has to have fasting glucose level greater than or equivalent to 7 millimole per liter, or random glucose level greater than or equivalent to more than 11.1 millimole per liter, or HbA1c 6.5 or higher according to WHO criteria, but the criteria for American Diabetic Association is slightly different. If you have been asked about the management of diabetes mellitus type 1, then tell about the MDT approach and insulin therapy. Questions related to diabetic retinopathy, nephropathy, neuropathy, and HLA association are expected. So be sure to prepare for these topics as well.